trauma and depression. Understanding the link and effective therapeutic approaches. The link between trauma and depression. Trauma and depression are deeply interconnected, with many individuals who have experienced trauma also suffering from depression. Understanding this link is crucial for developing effective therapeutic approaches that address both issues simultaneously. This video investigates the link between trauma and depression and discusses therapeutic strategies that can help individuals heal. Emotional and psychological impact. Trauma can have a profound emotional and psychological impact, leading to feelings of hopelessness, helplessness, and worthlessness, key symptoms of depression. The intense stress and emotional pain from traumatic experiences can trigger or exacerbate depressive symptoms. For example, a person who has experienced a traumatic event may struggle with persistent negative emotions, such as sadness, guilt, or anger, which can contribute to the development of depression. Neurobiological changes. Trauma can cause neurobiological changes in the brain, affecting areas involved in mood regulation, such as the amygdala, hippocampus, and prefrontal cortex. These changes can disrupt the balance of neurotransmitters, leading to symptoms of depression. Research has shown that trauma can alter the structure and function of these brain regions, resulting in increased vulnerability to depression. Loss and grief. Traumatic events often involve significant loss, whether it's the loss of a loved one, safety, or a sense of control. This loss can lead to profound grief and sadness, contributing to the development of depression. The grieving process can be complicated by trauma, making it difficult for individuals to process their emotions and move forward. Social isolation. Individuals who have experienced trauma may withdraw from social interactions due to fear, shame, or mistrust. This social isolation can exacerbate feelings of loneliness and depression. Trauma survivors may struggle to form and maintain relationships, leading to a lack of social support and increased risk of depression. Therapeutic approaches for trauma and depression. Trauma-focused cognitive behavioral therapy, TF-CBT. TF-CBT combines traditional CBT techniques with a focus on trauma. This therapy helps individuals identify and change negative thought patterns related to their trauma and depression. TF-CBT also includes components of exposure therapy to help individuals confront and process traumatic memories in a safe environment. Through TF-CBT, individuals can develop healthier coping strategies and reduce the impact of trauma on their mental health. Eye movement desensitization and reprocessing, EMDR. EMDR is a therapeutic approach that helps individuals process traumatic memories by using bilateral stimulation, such as eye movements. EMDR can reduce the emotional intensity of traumatic memories, alleviating symptoms of both trauma and depression. The structured phases of EMDR guide individuals through the process of desensitizing and reprocessing traumatic experiences, leading to significant improvements in mental health. Somatic Experiencing, SI. SE focuses on the body's physical responses to trauma, helping individuals release stored tension and trauma from their bodies. This body-centered approach can reduce symptoms of depression by promoting physiological regulation and emotional balance. By addressing the physical manifestations of trauma, SE can help individuals achieve a sense of safety and stability. Mindfulness-Based Cognitive Therapy, MBCT. MBCT combines mindfulness practices with cognitive therapy techniques to help individuals become more aware of their thoughts and feelings. This awareness can help individuals break the cycle of negative thinking patterns associated with trauma and depression. MBCT encourages individuals to observe their thoughts and emotions without judgment, fostering a greater sense of acceptance and resilience. Medication. Antidepressant medications can be effective in managing symptoms of depression in individuals with a history of trauma. These medications can help restore the balance of neurotransmitters in the brain, improving mood and emotional stability. Medication can be used in conjunction with therapy to provide comprehensive support for individuals experiencing trauma-related depression. Case studies. Case Study 1, TF-CBT for Trauma and Depression. Jane, a survivor of childhood trauma, struggled with severe depression. She began trauma-focused cognitive behavioral therapy, which helped her identify and challenge negative thought patterns related to her trauma. Through TF-CBT, Jane also processed her traumatic memories, leading to significant improvements in her depression symptoms. The combination of cognitive restructuring and exposure therapy allowed Jane to develop healthier coping mechanisms and achieve emotional healing. Case Study 2, EMDR for Trauma and Depression. Mark, a combat veteran, experienced both PTSD and depression. He underwent EMDR therapy, which helped him process and desensitize traumatic memories from his military service. As a result, Mark experienced a reduction in both his PTSD and depression symptoms, leading to improved overall well-being. The targeted approach of EMDR enabled Mark to address the root causes of his trauma and achieve significant relief from his symptoms. The link between trauma and depression is complex and multifaceted. Understanding this connection is essential for developing effective therapeutic approaches that address both issues simultaneously. Therapies such as TF-CBT, EMDR Somatic Experiencing, and MBCT offer promising strategies for helping individuals heal from trauma and manage depression. By integrating these approaches into treatment plans, therapists can provide comprehensive support for trauma survivors, promoting recovery and resilience. The combination of therapeutic interventions and medication can offer a holistic approach to healing, addressing both the psychological and physiological aspects of trauma and depression.